glad to be here this afternoon, and I'll be taking us on a topic that is at the center of global health security, and I call the topic One Health, AI, and Zoonotic Surveillance. So it's trying to bridge the gap between animal health and public health. All right, firstly, I want to start with the terminology One Health. I'm sure some of us might be familiar with it, some of us might be hearing it for the first time. So One Health approach is simply an interdisciplinary approach towards optimal health, whereby we consider the interconnectedness of animal health, human health, as well as environmental health. And this is of importance because there's a zoonotic challenge in the world currently. 75% of emerging infectious diseases are known to be zoonotic, while there's a new emerging disease coming up every year on an annual basis. And there's also a projected annual economic impact of about $500 billion that could be lost due to zoonotic diseases. And this is quite important and crucial in our age because we get to react to these diseases. We are not proactive in our approach, we are more reactive. So most of the times, these diseases are already endemic. They become epidemic and pandemic before we start reacting to them. And this takes me to one of the papers or works I did some years ago. This was in 2021. That was when I made a call out onto the general public as regards the neglect of mpox. Then it was still known as monkeypox. And a year after that, that was in 2022, mpox became a global problem. And many of us are familiar with that. Then in 2020 to 2023, we saw the emergence of COVID-19 pandemic. While currently we have what we call the avian influenza virus that is also ravaging the society. So this tells us something that these diseases are known not to respect boundaries. However, we've not been proactive enough in our approach towards containing them. And this takes us to the surveillance challenge. So surveillance challenge is quite important in the sense that surveillance systems currently are quite fragmented. They are quite fragmented in the sense that we have animal health, human health, as well as environmental health data not talking to themselves. So these healths are kind of fragmented in context. And we need the data to be bridged together. We need all the data to be bridged together to be able to contain diseases because they are zoonotic in approach and they are also no respecter of boundaries. Another thing I want us to consider when it comes to surveillance challenge is the siloed data system. So many times when we get data from the field, we are not quick to analyze them because these data are collected manually and it takes time to really analyze many of these data, especially when they are large data sets. So this takes us to the importance of AI to this approach. So AI-powered One Health surveillance system helps us to act in a faster way. We have traditional surveillance systems that are currently in place towards solving global health problems like this. However, these are not sufficient to be able to contain diseases as fast as we could. So because one analogy I will paint for us to understand this is, imagine a disease outbreak on a poultry farm in, let's say, Nigeria, where I came from, and imagine a disease outbreak in a poultry farm in Nigeria, and imagine a system that is in place such that once a disease outbreak comes from such region, there is a system that correlates the data with demographic or climatic conditions like water, temperature, and all these things. It correlates it, and it's able to predict the spillover that could occur in the human population. That is where AI comes to place in this kind of scenario. So we could have predictive models that could predict what is the next infection to anticipate based on the data that has already been programmed into it. And I want us to understand that AI is as good as the people and the data behind it. So, and that's one of the things we have to consider, and that's why we have to be context specific. So looking at it from this angle, we could see that this AI model could be used in wildlife monitoring, which is one of the things that our speaker spoke about earlier today. One of our speakers, he spoke about the need for us to detect from the invasiveness approach that has been used over the years. So we have a lot of invasive systems that have been used, whereby we approach animal and we don't consider the animal welfare, we don't consider animal sentience. So this is one of the problems that the AI systems tends to solve. The second one is the genomic surveillance. Though AI systems are also able to process and also to interpret mutations that occur in disease conditions or in disease outbreaks. Then the last one is the predictive model. So the predictive model is just like I explained, just such as we have in a farm, there's a disease outbreak in his farm, there's a predictive model that is able to predict that, okay, this disease can actually pose a risk factor to the human population. And next, I would like to look at some use cases or some common use cases that are ongoing in the world of today. So the first one is the Blue Dot. So some of us might be familiar with it, but Blue Dot is an AI platform that was used to predict disease outbreaks. So for instance, this Blue Dot was quite instrumental in the case of COVID-19. That was some years ago, in 2019. The Blue Dot was able to predict the outbreak of COVID-19 even before the WHO announced it as a global problem. And it was also instrumental in the Ebola outbreak that occurred in the year 2014. So this is an example of an AI tool that could be used to predict infections faster than the human ways. Then the second one is the AskRaw. So AskRaw is currently a chatbot that could also be used to interface with One Health systems. That is, it covers the human health, animal health, as well as the environmental health. So with this chatbot, you can ask questions. It can give you insight into certain diseases that you might have or might be experiencing on your farm or amongst your animal population. The next one I'll talk about is the ethical AI. So how does this play a role, or how can we use AI in an ethical manner to be able to contain these diseases? The first one is minimal invasiveness, which I spoke about earlier. So there's remote sensing structures that could be put in place such that we don't have to enter into the wildlife territories to capture them manually as we have been used to. The second one is the autonomy. So we have the non-intrusive behavioral pattern. So this is talking about the animal welfare and the animal sentience aspect. So such that we put into consideration that these animals have their own rights and we can't just do anything to alter their behavioral pattern. The next one is data sovereignty. So data sovereignty in the sense that we're able to merge this data together, data from the animal health group, from the human health group, as well as that of the environmental health group. Then the last one is the benefit sharing. This would help all the angles of the health systems in the world. That is, the human health will benefit from this data, the animal health system will benefit from this data, as well as the environmental health system. Lastly, I'll just encourage us, and this is a call to everyone seated in this room, that there's a need for an interdisciplinary collaboration towards solving this global health challenge. And I want us to know that we have to be context specific when it comes to this problem, and that's why we have to involve community. There has to be a community engagement system, because the way diseases, the context which each disease spread in different geographical location differs, and that's why we have to engage the community of each territory in building whatever AI solution we might have for them. Then lastly, there's also need for policy frameworks so as to guide the ethical use of AI for the right use. So I'll leave us with this note, and I'll end on this note, that the next outbreak is not a function of if, but it's a function of when. But the question I have to everyone in this room is that, are we prepared to contain the next outbreak, or should we be prepared for another lockdown? Thank you so much.